we go.
Are we ready? Yeah, it's 8 o'clock, right? Let people in.
Woohoo.
Where are you going to be seen?
Oh, well, to be seen, I'll pop over there.
Okay. Oh, I was thinking. Oh, I thought we were gonna-
Morning, Amy.
I can't do that.
Morning, everybody.
And I already have audio on, correct?
Mm-hmm.
Okay, good morning.
Hope everybody has some coffee. I certainly do.
I drank it before I got here, so water for now.
That works.
People always tell me, don't do too much, Julie, you already come prepackaged.
I'm never up this early, so you guys are lucky. This is a rare sighting.
And I had that conversation about, I'm up this early, I'm just not usually on camera.
I should be sleeping like a baby. That's okay.
How many people are we expecting?
We are expecting 26,
Okay,
so we can certainly give it a moment. But
yeah, we'll just a moment and then I'm gonna get started because starting on time will let us end on time.
love it.
That's the facilitator in me.
No, it's good, and everyone always appreciates that.
I do, even if there's stuff people want to cover, it's like, it's better to honor people's time than to not.
Exactly.
Yeah, I like Steve. I'm comfortable.
Julie, you'll see Amy's camera's on. She's our new training coordinator.
Oh, hi, Amy.
So she's our new hire. So
Nice to meet you.
Nice to meet you also.
Yeah.
All right, so we have 17 people on that I can see from my screen. I'm going to go ahead and get started, and anybody who adds on can join in the introductions.
sounds good. Would you like the slides up for intros?
Nope, not just yet. Oh, it'll be a split screen. Go ahead and put up just the opening slide. And then can I have people put video on if they're comfortable with that? I'd like to see people.
Nice to see faces.
If you're really opposed, I won't make you, but it'd be nice.
He's waiting.
Are we ready, Emily?
Yeah, go for it. Do you see the screen?
I can see a little bit of gallery view, but I can't see the slides, but
Can other people see slides? No? Oh, well.
there, you know what, if you want to leave it just like that and people can see slides, that's fine. Oh, there we go.
Here we go. Thank you. Sorry.
Hey, everybody. I'm Julie Benson, and I'm going to be your facilitator for today's training. I have a couple of things that I just need to get for housekeeping, and then we'll get started. First, we're gonna do some introductions today. And just remember, I would like to, when we do introductions for everybody who's participating, I'd like you to unmute yourself so that we can hear you. And before we do that, I'll introduce myself, and I'll also have Susan Reeser, who is here with us. I'm sure many of you, if not everybody, knows already. So today's presentation is on interviewing skills for vaccine hesitancy specific to COVID-19. And I have taught motivational interviewing skills in a number of fields. There are several fields that it's used in, and I'll mention some of those as we go through. But some of the names I saw on there, I may be familiar with some of you, and some of you may be familiar with me. But either way, I wanted to tell you just a little bit about my background so you're not wondering, you know, who is this person and why is she talking about this? First of all, I've been a communication professor for 30 years, and during that time have taught motivational interviewing skills in a number of courses. And then I've also done, for those of you who've been around a little while, contract and facilitation work and communication skills training for the field in public health here at the State Health Department for 15 years, on and off. On top of that, I've had the great joy for over a year and a half now of being hired in the epidemiology section as the COVID-19 response coordinator. Now, Magdalena Scott, the section supervisor, is now introducing me as the OG of COVID-19. Now, that does not mean that I know everything about COVID-19. What it means is I've played bench to just about everybody down there and have done everything from run lab samples to put your data in Midas or whatever. And I cover the phones a lot. So I have a lot of conversations, fewer now than before, with angry people, resistant people, people who are really polarized about COVID-19. And I think that's why you're here. I'm going to guess that's one of the reasons that you're here. So I wanted to let you know that I'm not coming into this COVID-19 thing blind, and wanted you to know I have some experience with it. I am not a first responder, so I don't have that. But what I'd like to do when we get to introductions for all of you after Susan speaks is that I would like you to tell me who you are and what role you play. So if you're an administrator, are you a nurse? You know, just something brief about what you do and where you're from. So be thinking about that. And I'm going to have Susan take the screen here for a couple minutes because she is what we call a subject matter expert in the situation, which is why we teamed up. And that is that she has, so if you hear me say SME and you're not familiar with that phrase, I might say it. She's our SME because there will be things I might say incorrectly in terms of provider world, but I'm going to have her help me with that in case there are things that could be said differently or better. And I'll count on all of you to do that as well. So Susan, as our SME, do you want to come on over here and say a couple things before we do participant?
Good morning, everyone. I'm here in the room with Julie, so I have my mask on and I'll let her speak. Welcome. And I just wanted to thank you for all the work that everyone with public health and COVID response is doing out there and what you have done for the last many, many months. And I felt the need, I get those calls too, like you do, of just how to have the skills to handle some of these calls or these face-to-face issues that come up with people, and how to best handle it so that everybody can, both sides can have a conversation, leave the door open, and know how to proceed. So again, we're very happy to be able to prevent this training for people to give you some more skills and help you deal with these issues. So thank you for being here, and I'm going to turn it back over to Julie.
All right, thanks. So I'll tell you a little bit about how this training came together, and we'll put an agenda up for today in a few moments, but I'd like to do introductions. And if people could just unmute and do an introduction, and I can't see all of you, so rather than call on you, just somebody start, unless Emily, you want to just go to, because you can maybe see everybody.
Yeah, I can certainly go through the list. And if there's anyone I call on or the folks in the chat that have already said so, if you don't have a microphone, feel free to put your intro in the chat. That's just fine.
That's a great thing. I just don't want to have a lot of delay in time of who wants to go next.
Exactly. Exactly. So we'll just start with Amy Elliott.
Good morning. My name is Amy Elliott. I am the new training coordinator for the Montana Public Health Training Center. So if you're going to be doing any additional trainings, you'll be seeing me on here, either by myself or in addition to Emily. I am Emily's right-hand gal.
Awesome. It looks like Asa Axon. Sorry if I'm mispronouncing that. Might have stepped away. Do we have Alicia? Alicia Mosnes? Forgive me if I butcher these. Alicia? What about Amanda?
Alicia is in the chat, Emily.
Oh, sorry. Oh, perfect. There we go. There she is. All right, Alicia, if you can introduce yourself. And then if Amanda's there.
I'm Amanda Marinovich. I am the epi at Butte Silver Bow. Yeah, I think that covers it.
Thank you. What about Carol?
Good morning, I'm Carol Kennedy. I'm the Chief Clinical Officer at Barrett Hospital and Healthcare.
Excellent. And Eva Kerr? What about Jesse S?
Jessica Schwend, hopefully. I work as the nurse manager out at Riverstone Health in Bridger and Joliet.
Awesome. I have a friend from Joliet. Very cool. Of course, we have a few intros in the chat, so please take a peek at that, everybody. Is Joshua on?
Hey there. My name's Joshua Kep. I work for the CDC Foundation, and I'm contracted to the Montana Immunization Department as a COVID communication specialist. I'm currently in Atlanta. Everyone's
Awesome.
having a good morning.
Not too bad. Hope Atlanta's good.
I'm sure.
What about Caitlin Hansen?
Yeah, can you guys hear
Emily,
me?
after you've gone through folks who have microphones, when we'll do all that first, but then would you read the intros in the chat so that
Of course,
Okay, thanks.
definitely.
Can you guys hear me okay? I'm
Yes.
using a different, okay, perfect. I'm using a different workstation than I normally do, so I wasn't sure if everything was hooked up correctly. Yeah, I'm Caitlin Hansen, and I am the quality coordinator for SCL Health.
Excellent. Thank you. All right. Let's see. Kim Bombard, I believe you'll be putting it in the chat. Yep, there it is. Perfect. Kirsty Nelson.
Hi, everyone. I'm Kirsty Nelson, and I am the public health nurse at Carter County in Ekalaka.
Ekalaka. Love that name. All righty. Well, it looks like Elle Harris. I'm not sure if you're there, or throw it in the chat. What about M. Leary? Oh, trying to unmute. Okay.
There I am. Lenore Harris, the COVID-19 coordinator for Cascade County.
Excellent. Thank you. And let's see, M. Leary. Maybe. Throw it in the chat if you can. Sarah Heineman.
Whoa, okay. Hi, I'm Sarah Heineman. I'm the director of our health services division at the Missoula City County Health Department.
Excellent. You're a name I know for sure. What about Sarah Long?
Good morning, everyone. I am the disease intervention specialist for Lincoln County.
Excellent. What about Stacy?
Hi there, can you guys hear me?
Yes.
Okay, perfect. I did turn my video on. I don't know if it's working.
It is. You look great.
Okay, I'm a Bobcat fan. Can you tell?
Uh-oh.
I'm just kidding. I'm all ready to come down for the weekend.
Oh, good.
So my name is Stacy Pinnell. I'm one of the public health nurses at Riverstone in Yellowstone County.
Awesome. And it looks like Taylor.
Hey, my name's Taylor Sweeney, and I am a nurse at One Health in Lewistown.
Awesome. And did I call on Carrie Cunningham?
Good morning. I'm Carrie Cunningham. I'm actually a provider at the Montana Health Center, the state clinic in Helena.
Excellent. All righty. I'm going to go through the chat. And then, of course, if there's anyone I missed after that, please speak up. I'm trying to keep track of the list. Alicia, if I'm pronouncing that right, is the Infection Prevention Director at Northern Montana Healthcare. And Asa, A-I-S-A, is the Director of Nursing and Clinic Manager for Gabbert Clinic in Glendive.
Wow.
And then Kim Bombard is works at the Immunization Clinic at Missoula County Health Department. I am usually the first contact to people calling with questions and comments for clients wanting info on vaccines. That is a big job.
You.
Eva, I am the public health director and catch-all for, I'm going to assume that's Marr County, like Thomas Marr. If I pronounced that one right. Toole County Health, Shiloh from Toole County Health Department in Shelby. I'm the administrative assistant and vaccine co-director. And then M. Leary is Mackenzie Leary, and she is one of the public health nurses at the Missoula City County Health Department. So a very nice mix of people. If there's anyone I missed, please speak up.
And do we have anybody that came in and needs to do an introduction, please?
That might be it.
Okay. And when you get a quick count, will you tell me what we have for total participants? Emily, it doesn't have to be the second, but.
We have 19 outside of us.
Okay, great. Thanks everybody for showing up this morning. I know it's bright and early. And I wanted to tell you just a couple of things before I show you the agenda for today. The way this presentation came together is this summer at Summer Institute, I did a class on sort of a workplace resiliency kind of thing, but focusing specifically on COVID-19 and what did we learn in the last year? What do we still have yet to do? And the best practices from each other and not just the current research that I had and a lot of the things. And we spent a day and a half, and I know that it was not only a good learning moment, but very, very helpful for people to hear that others were experiencing similar kinds of issues. And so Susan and I were talking one day about that topic, and she said, why don't you watch this webinar or this presentation similar to this one with me and join in, we'll watch it. So part of this is based out of a presentation presented from a presenter in Colorado. And I'm going to give thanks to Amy Spetnagel, who was the facilitator for that. She developed that in conjunction with a woman named Kathleen Garrett, who is at the University of Colorado. And they put together this presentation and we liked it a lot. We learned a lot. And then we decided we would offer one that was tailored a little bit more to the Montana audience. And all of you working in Montana know that we are not a one size fits all for what every other state does. So we made some adjustments there. So I wanted to give credit to they told me we could use the whole presentation and take it all, but I wanted you to know that some of this comes from what they talked about and some of it is what Susan and I decided to add to it in terms of content. So that's how it came about. Let me show you and I want to also acknowledge Emily, who's helping with tech. Emily Weller, I am so grateful for her to be helping with the tech. Even though I can do both at the same time, you can't be a very good teacher if you're dealing with the tech at the same time. And so thanks, Emily, really appreciate that. So if you could go to the next slide, Emily, for me, and we'll show the agenda for today. So we've done introductions already, and then I'm going to spend some time defining what motivational interviewing is. Some of you may have zero experience with this topic. Some of you may have tons of it. So to make everything better for today, I thought I would do a brief review on what it is. And that way, if it's old news to you, it'll be a quick recap. If you haven't heard of it, especially related to COVID-19 vaccinations, then this will be enough information for you to keep moving through with the other skills and strategies that we will talk about. And at the very end today, we'll offer a lot of resources to all of you to learn about other parts of this process. I will confess that as a presenter and a facilitator, I basically have a 4-hour presentation I could give to all of you. So we're just going to get as far as we can get in this time and introduce some of the basic concepts. So then we'll talk about the variety of dispositions that people come to the facilities where you are, or they're talking in the community, or wherever you're running into people and are asking you about this. Montana's one big small town, and I don't know about you, but they can grab you in the grocery store or next to you at the high school basketball game and start asking you the kinds of things that we're going to talk about today. So these skills are very transferable, not just there, but even in your regular everyday life that has nothing to do with COVID-19. Then we'll talk about some of the benefits of trying motivational interviewing. and some of the challenges to doing that. Then there are a couple of acronyms there, which I'm going to, OARS stands for open-ended questions, affirmations, reflections, and summary. You don't have to memorize that right now. I have a slide later, but it's important to do an acronym explanation before using it. EPE stands for elicit, provide, and elicit. And it's similar to OARS. They're just different ways of doing things. And then some other tools and questions to try and strategies to use. And then at the very end, after resources, we'll have a chance to, you'll have a link where you can do an evaluation of today's presentation. Okay, Emily, could you go to the next slide? Okay, today's learning objectives, 3 basic ones. To identify the patient's readiness for vaccination. And some of you might be thinking, there's a lot of resistance. Yes, otherwise they would have already shown up and gotten a vaccination. I'm going to say more about that in a minute. To explain various ways to use the MI skills. So MI is short for motivational interviewing, and what we call the MI spirit, which I'll talk about in a little bit, particularly regarding vaccine hesitation. And then we'll get a chance to practice some statements and strategies to address and mitigate or resolve vaccine hesitancy. Before we switch slides, I couldn't get the clip to fit just right without getting some more of the comedy that may not be appropriate for this presentation. But just earlier this week, I was watching a stand-up comic on Netflix who some of you may be familiar with. His name is Michael Shea, and he sat at the news desk on Saturday Night Live for several years. Whether you know him or you don't, he was talking about he is already vaccinated and all these things. And then he said, now my grandmother, I'm trying to get her to get the COVID vaccine. And he said, she says she's scared and she doesn't want to do it. And he said, well, why don't you want to do it, Grandma? And she said, well, I'm afraid of it because my neighbor got the COVID-19 vaccine and she died 3 days later. And he said, really? And she goes, well, she got hit by a bus, but still. So the reason I'm sharing that with you is I'm sure that's the least of some of the crazy things you may have heard for reasons that people don't want to get the vaccination. So their readiness may be they have every reason in the world to not get vaccinated. So we're going to explore those and have some skills that hopefully will make your job a little bit easier. Okay, next slide, please. Okay, so what is motivational interviewing? First of all, let's talk a little bit about the definitions and where this came from. First of all, the concept was originally, it was defined as motivational interviewing is a communication technique used to help people facing ambivalence and support those ready to make a change in health behavior. And more specifically, the CDC is now defining it right on their website. It's really more specific to the change in getting a vaccination, because I mentioned other fields where it's used, and it's been used for years in making changes in substance abuse or substance changing behaviors, smoking cessation, getting people to exercise, all kinds of counseling strategies. It's used in a number of fields where people are asked to make a behavioral change. But the CDC definition, I'm going to read it exactly. That first general one I gave you came from the person who created this was specifically talking about it in general. His name is William Miller. And then the CDC says it is designed to tap into clients' concerns and possibly their desire to change, to look for cues, both verbal and nonverbal, from the client. And at its core, I want to tell you that it includes the premise that also, and I want you to hear this loud and clear, this can make your job easier, and that you don't have to take it on if someone is an absolute no, wants to throw conspiracy theory at you, government, politics. There's some ways to find out where they are and ask some questions. And if they are a solid no, you do not have to take that on. You can let it go, and we'll talk about some ways to do that. Okay, in general, there's a 3-step process, but I feel like there's so many ways to talk about it that, this is just one way to look at it. First, whether you're talking to someone on the phone, or they're sitting in your office, or they've come for something else, and you don't know if they're vaccinated or if they're interested. So you're assessing their disposition, particularly if you know that they do not have the vaccination. Then the process is using motivational interviewing skills to talk, and then I put and listen to patients. So while motivational interviewing skills is taught as a strategy to talk, I'm going to tell you that it's really more about listening. And the way you do that is to use a few questions or affirmations or reflections of what they're saying. It does not mean you have to agree with them. It means you're using it so that they can feel heard and be validated as a person, because that's at its core, even if you totally disagree with what they're saying. It is not time to take the bait and have a debate. And then after you've used the skills, whether it has been successful or not, or they moved this much, you close the process with making a plan, even if they're flat out no's. Okay, next slide, please, Emily. Okay, so I mentioned earlier about the MI spirit. And I feel like even if you only got one skill later on out of this, or had a couple takeaways, if you come back to the spirit, whatever you say, even if you don't word it exactly perfectly, the spirit alone will help guide what you say. You are respecting the autonomy of the patient to make this choice. We may not feel like it's a choice they should have, but that's not up to us, especially in the climate that we're living in, and especially in Montana. It's been made pretty difficult to require anybody to do this. So, but we can honor the autonomy of the person to decide whether they want to move a little on their thought process. Also, if you look at it as being a collaborative experience, and believe me, I know it's hard. You are all exhausted. Everybody is, people who don't want to get the vaccination say they're so over COVID. Well, so are all of we. We all are, you all are. We're all over it, but in collaboration, instead of it being a you against me and it's an adversarial, let's convince each other, and use this skill at Thanksgiving next week. Don't let people talk about this, okay? Don't have it be your political dinner conversation. I make rules about that at my own house. And it's a collaborative conversation. And if you view it that way, you are coming alongside the patient with where they are. You don't have to like it, but it increases your odds that your skills and what you're trying and the conversation that you have might be more successful, partly in the relationship and trust, but our ultimate goal is to get more arms willing to get needles in them, right? Okay. Evocation. It sounds like you're trying to evoke something that's bad, but it's not. We are trying to evoke, which we'll talk about later, or use the word elicit, some information from them. And we don't use questions like, so why do you think that is true? Okay, now I'm being sarcastic and I'm exaggerating it, but we do want to get some information from them, and there's a way to do that. And then just compassion. And I know that it's hard to have compassion for someone who's sharing information that is either inaccurate, or what you really want to say is not what you can say out of your mouth. It may run through your head, but having compassion for where they're feeling and where they are in this process. Okay, I'm going to pause just for a moment and see if there are any questions. We'll just take a moment. Please don't be afraid to ask the question.
Feel free to use the chat box at any time as well. I'll be checking.
Okay, be sure to put it in the chat if you would like to, or if you are on video to wave your hand and we'll catch you. Before we go on to the next slide, I wanted to, again, I had mentioned Susan and I collaborating on this and in the subject matter expert part. One of the things I have invited her to do, and I hope any of you might do it, is as I give examples, I have done this in a lot of different fields. And if you're thinking, you know, I'm not sure that would work in the nursing situation because I'm not a first provider, I want you to say, hey, maybe we could tweak that, Julie. And I'm inviting Susan to say, you know, probably in the nursing world or when we're talking about immunizations, we could phrase it a little differently. I have very thick skin. My goal is not to say I know everything about this for your field. I know a lot about the process in different fields. So feel free to offer alternatives and you're going to get some chances to practice. Okay, next slide, please, Emily. Okay, so back to the ORs, where we were talking about what each of these is. And I want to provide some examples. Let's see, hold on. Get something with my own slides here. Okay. Just be patient with me for one moment. Over all that went. There we go. Okay, so the first one, open-ended questions, is the first letter in ORS. And so what you want to do is ask questions that will not elicit a one-word answer. So saying things, you know, do you want to have more information about this? They can just say yes or no. There are different ways to do that. So an example might be, you know, instead of saying, you might ask them for permission, which is also that autonomy thing. You might say, would it be okay if I shared some information with you about how the vaccine was developed? Now, only do that if you can speak to that. But they may have said, maybe a concern was, it was developed so fast. And one of the things I'll be emphasizing, and we'll have examples later, is that if you don't know how to speak to the medicine or the science, it's okay to say, that's not something I'm familiar with. I can't speak to that. So you would want to seek out your medical provider or somebody else who could answer that question. And then you can follow it up with what I can tell you, and then speak to what you are able. But we want to focus on you listening, not necessarily having to get into a debate with them. So you can ask questions that start, how can I help you find more information? Tell me how you're feeling about this. Tell me what you know about high risk factors for people who might get COVID-19 and have a more severe case. Or how can I help you with whatever their story is? And I want to give an example of things that sound like questions. And again, I'm being extreme here, but if any of you've raised kids and teenagers, one of the things you want to say sometimes is, what were you thinking? That's not a question. That's a judgment and harsh. And you don't want to say, why would you think that drinking bleach is going to fix this? You're going to want to ask questions that give them a chance to say what their story is. Here's another one. How might things change for you if you were to get the vaccination? And we're going to be talking about picking up on change talk. So if you have a patient or a potential client and they're saying, they don't want to get the vaccination, but you hear a tone of voice, maybe it's verbal, maybe it's nonverbal, but you hear a tone about them really caring about their 85-year-old mother or grandmother. That's going to be a spot where you might be able to say something where you're finding out some information. So affirmation and reflection, one that does a little bit of both, is sounds like you really care about being able to visit your grandmother or your mother. And you're reflecting back what they say. because those are the little pieces of opportunities where you might be able to say at some point in the process, in having a conversation with them, that sounds like you really care about visiting her and you're glad for her to get the vaccination. What about you trying to visit your grandma? Tell me how that'll work. And even if they're just thinking about it a little bit, one of the theories about persuasion is that people think you got to go from here to here, and you've changed somebody's mind on any viewpoint from here to here. It does not work that way. If they move this much, you've gotten somebody to reevaluate their viewpoint. Affirmations. It's basically a statement or a gesture on your part that recognizes their strengths and acknowledges behaviors that might lead toward change, even if it's just big or small, like I mentioned already. Doing the affirmations honors who they are, and it also starts to build trust that they might actually have a conversation with. So you might say something like, and this would be a reflection as well as an affirmation, sounds like you're worried about your kids at school. You're wondering if you don't get vaccinated, are you at risk if you've already had COVID? You said you already had COVID. So just reflecting back what they actually tell you. One that we've started to hear more about is that as much as people have enjoyed some of the time of working at home, some people really want to get back to work. Now, depending on what they do, they might be thinking, you sound like you're worried you're gonna have to work from home forever. You'd like to be able to travel. You might like to be able to work where you can travel. And you might have to travel out of state where people have different rules. And so you want to be reflecting back the concerns that you hear anything. And then when you talk about summary items, that isn't just at the end of your interaction with this patient. It's anytime you can summarize what you've heard. So all four of these things could happen in one sentence. There isn't a prescription to say it exactly right. But one of the things that I wrote down as an example is that a way to let people know that you're affirming them and you're summarizing, you say, so you sound worried about being able to travel. You sound worried about your significant other who's immunocompromised. Did I get that right? Did I understand what you're saying? And you let them correct you if you don't have it right. And it's letting them know they're an equal to you, regardless of the viewpoint that they might share. Okay, next slide, please, Emily. Okay, so briefly, we'll talk about the dispositions that people have about vaccination. And I say briefly because these aren't going to be new to you. There are people who come in and are very accepting of the idea, and your motivational interviewing skills really just involve getting them coordinated with the right time, the place to get the vaccination. Accepting with questions. That might be someone who says, yes, I want to get the vaccination, but I'm worried about missing a little bit of work if I have bad side effects. So you can address, you don't have to do a lot there. They've already said they want to do it. You can talk with them a little bit about their work scenario. It's when we get to the hesitant, which we'll talk about more in the examples, and flat out refusals. And you already know what that looks like. Okay, next slide, please. So reasons for hesitancy or refusal. I put a few things here. Misinformation, misunderstanding of information, anecdotal evidence. I can't tell you how many times I have people at the gym say to me, well, I heard from my cousin that her son had this happen and that was all because of COVID. Or that misinformation. I heard that hospitals get paid more money if they declare it a COVID death instead of something else. And we all just cringe at those things. Okay, so, or the fear of side effects. And then I put what else? So I'd like to ask you to either unmute and offer or put in the chat, what are some of the things that you hear for refusal or hesitancy? What you personally hear? Did we really get them all? Emily, is there anything? Oh, there's somebody in the chat. It says, I know someone who is now, I don't,
Magnetic, shake my head.
shaking my head. That's what I was gonna say. That's shaking my head. Yeah, I know. We're all shaking our heads, right? Thank you for sharing that one. Anybody else want to throw something out there that you heard? Here we go. I don't like being told what to do. I heard that yesterday while I was here at work. Yep. What else?
The government doesn't have your best interests in mind.
Right. We get the government conspiracy theories, right? It causes infertility. Yes, that's the reason my 21-year-old son waited a long time. He was worried and he was doing real research with real websites. And finally he said, I will get it, Mom. I'm just, I want to wait a little while. If you've heard, I want to see how this happens with people my age.
Someone wrote, people die from the vaccine.
Yeah, I've heard that too. I am young, getting COVID isn't a big deal. And if people are older, they can just stay home. Yes. And part of me wants to say, you know why the older people aren't as sick? Because they did stay home. And yeah, I hear the younger thing. I've got youth on my side, all that kind of stuff. What else? I'm not getting the flu shot now because the COVID shot is mixed with it. Oh, goodness. Okay. It's a good thing we don't have all the patients here as I'm responding. I'm not doing MI very well right now, but that's not my job today. I had COVID, so I have natural immunity. Yes. I know people who've had it twice and they said the antibodies are very high. I heard that in my personal life, came to work. And at that time, Jim Murphy was still here. And I went to him and I said, Murph, tell me, is this, if you have, do you have a lot of antibodies? And they're like, it makes no difference. You can still get it. COVID is no worse than the flu. It's not that bad. Okay. What else? For a lot of, is POC point of care?
People of color.
People of color. I was going to bring it up. There is some historical evidence. Oh, it went away.
Oh, there is some historical evidence of people being treated unfairly by the medical system, and differentiating that from COVID vax can be hard for people.
Absolutely. And you know what? We're going to watch part of a video here shortly, and you're going to see that addressed. All of these things actually are addressed in the conversation. What else? Okay, well, we'll pause there in the interest of time. I'm sure you have more, but if you decide to throw them in the chat, it'd be nice to have them on record. We are recording this, and the things that will be in the chat, we capture that as well, don't we, Emily?
Yes, we do.
Okay, great. So if you decide to add something there, let me know. All right, let's go to the next slide, please. Thanks for all your contributions. Those are things I have heard myself. So common client patient scenarios. I'm actually, we've talked about some examples from you, which we may revisit of what to do in those particular scenarios. I'm gonna have Susan talk for a moment, and then we're gonna watch part of a video. And this is about actually trying to use some of these skills.
And I'll just stand from here. So this was,
we still want,
okay.
All right, now you can have your head seen.
This was quite some time ago, and I probably didn't use my best motivational interviewing skills at the time. But a gentleman called and he said, I am calling because I am really worried about my family getting COVID, and I just don't trust this vaccine because the government developed it, Dr. Fauci developed it, and I don't want that. But I've done my own research, and I would like to get BCG, the tuberculin vaccine for my family, and I can pay for it. I'm very concerned and I would pay for it. So can you get that for me? And so there's all kinds of things that you can think about right now, like how would you handle that, or what would you say to him? And I was just pleasant and kind with him. I said, that's really concerning. You sound you're really concerned about your family. Let me see what I can do about finding that vaccine for you. I don't know that I can do that. So just think about some of the things that come into that, of what you could do and what you could find. I had never heard anything about the BCG vaccine used with COVID at that time. I didn't, You know, a lot of times people ask you questions that you have no idea where this stuff came from. And so you just have to say, I haven't heard that. I did some exploration. He gave me his phone number. I said, I'll see what I can find out. And I did call him back to tell him I wasn't able to get that for him, that he would have to pursue that through a private provider. But when I did call him back, he was very appreciative. And he said, really, thank you for calling me back, because I really didn't think that you would. But at least in that example, I like to bring that up because there's a lot of motivational interviewing things that I could have done and that I would do next time. And maybe you want to think back on some of those ideas too, to get you ready for the next encounter.
Thanks, Susan. So I'm going to ask Susan, put her on the spot. What was in your head that you wanted to say? And just tell it flat out.
Okay,
when he said, you said BCG?
Yeah.
Okay. What did you think? And all of you all can think about what you might have wanted to say too.
Yeah, first of all, it's like, you know, where did you get this? Yes. What kind of research did you do? We have 3 really great vaccines. If you don't like Dr. Fauci, there's 2 other vaccines to choose from.
I was thinking much more harsh, like, where in the world, what in the heck are you thinking? So those run through your head. And Susan what she was saying is, well, if you don't like it, there are other vaccines. She did not do a bad job. What she did was the autonomy. She called him back. That's that leaving the door open that we'll talk about. And I'll say several times throughout this, but it's really important. I compare it to, I teach yoga in my copious spare time, but we call it yoga practice, not yoga perfect. And so MI skills, you're going to get better at it the more you do it. It's not that you're going to do it perfectly, but in this scenario, she built trust with this person that she would call back. Now, whether he kept going doing that one, we don't really know, but there are things that you can say without having to get into a fight with them. So you've shared some examples of things that people say to you. What I'd like to do is I'll have in just a moment, Emily, I'll have you click on the video and we're going to watch about 7 minutes. And then I'm going to have you observe. I want you, while you're watching it, to jot down anything that you see as helpful and anything you see that could be done better. Just jot that down. All right, so when you're ready, Emily, if you could click that link, we're going to play to about 7 minutes. I'll let you know where I want to pause.
Make sure, let me know that you can hear it.
Well, Ms. Jones, sounds like what we're going to do is we're going to just adjust the doses of your medicines for your blood pressure. Hopefully that'll keep things in check. It's great seeing you, and I'll see you very soon. We'll have you come back in like a month or so. Is that okay?
It is. It is. So,
oh, I forgot to ask you. How's your mom?
Oh, mom is she's okay. She's okay. I don't know if she told you during her last visit that we lost my aunt, her sister, due to COVID, and so it's been a really hard time for her. But outside of that, she's okay. I know she misses her sister so much because they talk like every day, especially during this time of pandemic. So, right now she's okay health-wise. She's okay. She's taking her medication. Just really missing her sister.
Yeah. She feels isolated.
Yeah, she does.
Yeah.
She does.
Well, thank God she has you.
Yeah. I try to do the best I can. I love my mom.
Yeah. But I said this to her, and I'm going to say it to you. I'm so sorry for your loss. It's, this virus has really ravaged the community, So, well, at least some good news is I think your mom's coming in 2 weeks, and we will have the vaccine by then, so we can give that to her, and we can also give it to you when you come in a month, because you have diabetes, so you'd actually fall into the category of getting the vaccine. All right.
Okay. Well, listen, I can definitely talk to my mom about it, and she can definitely follow up with you if she has any other questions. But I don't think I will be taking the vaccine.
Oh, yeah. Okay. All right. You're not interested, huh?
I'm interested in my mom, if that's going to keep her healthy, especially with this, with the passing of her sister. I'm sure she will, want to do whatever she needs to do to make sure that she's protected against
Mhm.
COVID. To be really honest with you, Dr. Burns, I'm just really unsure. It just feels new.
Mhm.
I don't know. I've done a little bit of research, and I don't know. To be honest, I'm just really not trusting. I don't know how else to say
Mm.
it. You know what I mean? I'm just
Mm.
really not trusting.
Mm.
You can barely get me in for the flu shot. So this whole COVID-19.
I don't think I got you in this time, if I
Yeah,
remember correctly.
you didn't. You didn't get me.
That's right. That's right. No, it's true. Okay. I didn't know that that you had that perspective. I have a few minutes. Is it okay if we talk a little bit more about the COVID vaccine? And I
Yeah.
just kind of want to explore your perspective about it.
Okay. Okay.
Yeah, you were mentioning that you're not sure about it, and you also mentioned that you're not trusting. Could you tell me a little bit more about that?
Yeah. I mean, since they've been talking about this vaccine, like I get it. I see how COVID has definitely the impact of COVID on the entire population. And then I also, like I said earlier, my aunt passed from it, and I know other folks from the community. And while I want to be healthy, right, and I want to guard myself against contracting COVID-19, the vaccine, it just feels so new. Even with the research that I've done, I don't know. I'm just really not trusting. Like, I mean, I think it's almost the same way that I feel about the flu shot. I'm one of those. It's like, well, if everybody else is vaccinated, then I should be okay. What's the impact? Like, what is the long-term impact of this vaccine? Like, I don't think we have enough information yet. That's where I am.
You're feeling some distrust about the information that's out there about the vaccine. It's new. There's a lot of unknowns that we in medicine don't have answers for.
Yes.
And so that's why you're hesitant.
And the medical profession hasn't really been nice to people who look like me.
It's true.
To be honest with you.
Yeah.
When I think about, while doctors have made great strides in medicine, a lot of it was on the bodies of Black and brown people. So I don't know. I'm just not trusting.
Yeah. I wonder if you've been on the personal end of discrimination and bias in medicine.
I mean, I felt like I have.
Yeah.
I felt like I have. Sometimes it's hard to prove, right? Because you don't know you don't know for sure, but I know what it felt like.
Yeah.
I know what it felt like. So I felt that. I felt like oftentimes that my voice is not, that the doctors can be dismissive. Like when I'm saying that, like, this is an issue, it's like, you get the look like, is it really the issue? You know what I mean? Like, so sometimes I feel dismissed, and I don't know if that's because I'm Black or a woman or both.
But it sounds like you felt like you were not heard.
Yeah.
And you weren't respected.
Absolutely. Absolutely. And because, I'm pretty knowledgeable about, I know about me. I may not know everything there is to know about medicine, but I know me because I live in this body. And when I'm feeling dismissed, or that the practitioners are being dismissive, I take my business elsewhere.
And your relationship with healthcare institutions and other providers has been such that they don't hear you. They don't hear you out. They don't respect you. They don't treat you as an equal. And then just historically that there's been this legacy of medical progress really kind of dependent upon the non-consensual use of Black and brown bodies.
Yes.
And so I totally hear you when you're talking about distrusting, especially these latest developments.
And I don't mean to cut you off, but like, how do I know this won't happen now? Right? Like, so I get the vaccine, right? And I'm experiencing whatever side effects that I experience that may not line up with your research. Like, how do I know I won't be dismissed then?
Perfect. If you could then stop showing the video and we'll come back to writing. Okay, great. So what I'd like to do, whatever you've written down, is Emily has some pre-organized breakout rooms. She's gonna put you into some breakout rooms virtually, and I can duck in, but we're probably not gonna have time where I can duck into everybody. If I had you for the day, we could do lots of that, but I don't. So Emily, if you could put people in breakout rooms virtually, and then I'll just talk about what I'd like you to do in that breakout room for a few moments.
Certainly. How long would you like them in there?
Let's see where we are with time. Once everybody's in there, why don't you, I wanted to talk for about 5 minutes, so why don't you say 6, and that way people can.
Okay, sounds good. You'll see an invite pop up. If you do not have a camera or a microphone, please use the chat in your room, and that should work just fine. Okay. You should
so
see.
have to click join, or are they already there?
No, they'll have to follow the link. There they go.
Great. And then everyone will still be able to hear me.
Not out here. No, you'll have to go into the room.
Okay. Can they hear you?
No.
Should have given some directions then ahead of time.
Oh. But I can send you in to each one. You should be able to pop around as
yeah, can you just pop me into each one real quick?
Yep, so just return to the room when you're done and I'll put you in the next one.
Okay. I don't know if I can. Oh, I can. Oh, I can. Okay.
Laurel, if you're out there, let me know if you have any trouble getting into your room.
All right, thanks, Emily. Can everybody hear me again? Either a thumbs up from somebody or in the chat that yes, you can hear me.
Yes,
I can hear you.
I apologize. I messed up the trick on that in terms of not giving you the directions before you went in there. Whether you had conversation about what I was, I tried to duck into everybody. Just wanted you to have a moment to talk with the other people in your group about what you thought went well in the video and what could have been better. So I would just like to go to each group and have you offer one thing that you thought went well from either one person, or if you made a list or whatever you did is okay. I want to check in with group 1, and if someone wants to offer something they thought went well in that video.
We thought that he gave her time to express her concerns and her feelings.
I agree with you. What did you think could go better?
Possibly giving her direct reasons, like with her being diabetic and that, of the reasons why it would be beneficial for her to get the vaccine and that she's at higher risk.
Yes, and that will come if we have time to watch some more of the video. That does come later, so good job. All right, group 2. What went well?
I think we thought the fact that she had a relationship with that provider previously and he was really willing to listen went well.
Great. What would you suggest that maybe could be better?
Maybe somebody else can chime in. I don't know that we got to that much, but one of the concerns was time constraints, and maybe it wasn't, fully elicited in that video.
No, it wasn't. It's a longer video. I just wanted to show the first part of it. And we also know that you don't always have that much time, but in this situation, we're looking for a perfect scenario, so it's okay. All right, group 3, what went well?
Group 3 was Lori, Mackenzie, and Sarah.
Let's see. I'm sorry. I thought we were group 4.
You might have been.
Oh, I'm sorry. You are group 4. There was no group 3.
Okay. All good. I think that we thought overall, he did a pretty good job. There was good rapport. He validated, he rephrased, offered, hey, do you have time to keep talking about this? I want to hear your perspective. The only thing that we said in the beginning was that he seemed like a little shocked when she first said that she wasn't interested, in like how you might control your response when you're not expecting that, I guess, but it's hard to do. So it takes practice.
It does take practice, and he got much calmer after that. But you're right. He did have us. He was surprised, which we all might be, but he was calm. And as you mentioned, he asked her if she had some time to hear some more information. And then that whole asking for permission is one of the autonomy items and one of the other strategies we use as well. So, okay. Was there a group 5 or just a group? I think group 5 was just Susan, and then group 6, Emily?
Group 6.
Okay, group 6. What did you think went well?
I thought the way that he repeated back to her, her concerns made her feel listened to, I think was important.
Particularly when she was talking about how she doesn't like being dismissed. And so addressing that's very important. Okay, what did you think might go better?
I think, and you said it might be coming up, but the kind of the risk factors to her of not getting vaccinated, I think. But if that's later in the video, I think that was important.
Yes, we're going to use that in just a little bit. Okay, and so since I have you all present right now, I'm going to talk about a couple other topics, and we're going to watch the rest of the video. And when you're in those groups, again, just looking for any of the strategies we've talked about, something that you liked, that you thought went well, something that they could do better. And maybe the something that you like is something you're going to steal, and you're going to have access to this video and watch it again. So if you wanted to do that. So I apologize for the tech screw up, that was on me. So we're going to go on this slide that I have here, we've talked about autonomy and letting people make their own decisions. And he still hasn't said, you know, you have to do this or anything like that, to be supportive. And then the elicit, provide and elicit. And he did a good job of that by asking, would it be all right if I shared some information? He provided some information. Then the actual process as a tool is that you then might say, so what do you think about what I've shared with you? That might be one thing you can do. So you're eliciting a response to find out, you know, what do you know? And that comes up a little, you might see some of that in the rest of the video. I'm going to give you an example that relates to all of you, I think. So if I were going to do EPE with all of you and you were all sitting here, I might ask, you know, what concerns you about learning motivational interview skills? Now, we don't have time to have me go around and do it, but you might say something like, I don't have time in my job. I'm exhausted. I'm over it. I just am here to give shots. You might have concerns about trying to do this in your everyday life. Makes sense to me. But I might ask you, so tell me what concerns you about trying to do these skills. You might say, oh, it feels uncomfortable. It's hard. Sure. Then I might say something like, would it be okay if I talk to you about some of the ways it might be easier for you to try this? And if you said yes, then I might say something about, you know, one is using a calm tone of voice. One is remembering that 2 to 3 minutes of your time may feel like a lot, but that investment may pay off big where your job is actually easier. And the other thing is a tip I might give is about remembering that they would say this to whatever provider was sitting in front of them. That's where they are. It isn't about you. And the more you can say, okay, they flat out refused, and I don't have to take that on. I don't have to fix it. The other thing I would say about that is that most providers have told me that they've never had anybody say no if they say, would it be okay if I tell you a little more? However, I'm going to say COVID-19, you may have had people say, no, I don't want to hear anything. One of the things that you could say, so I'm eliciting, you know, I'm giving you some more information, is that you might say, okay, fair enough. Thank you for setting your boundary with me. And if that ever changes, let me know. And you just describe it like you're describing the weather. No intensity to it. It's just, it's not a flat affect, but it's not a hyped up one. So I then, after giving you some tips, if we were doing a training just for you guys on this topic, then I might say, so what do you think about the tips I gave you? And then you could say, those don't apply in my life at all. Or you might say, one of those works for me. Never thought about saying I could, you know, I don't have to take it on. All right. So that's a way I just did that if I got to have you as a group to do EPE, just because really this presentation is a little bit of motivational interviewing by me asking you things like this, because this may be something you don't want to do. If you're just tired of it, you're over it. And then finally having that plan for follow-up, which, you know, would it be okay if I called you back, which is what Susan did, and she called the person back. And again, when I said that, a tip of saying, well, you know, thank you for setting your boundary for me. Let me know if that ever changes. Here's my contact info, because you can always leave the door open. All right, next slide, please, Emily. Okay, we're going to go through past the next, because we are scenarios, we've been talking about some of these already, and we will not have time to do them separately. So keep going. I'll show you where I want us to be. One more. Oh, go back one more. I apologize. Okay, so this scenario we've talked about a little bit. The other slides talked about how safe is the vaccine. The other one was about government conspiracy. You've all said these are things that happen. And then we've mentioned a little bit touching on what to do when presented with information you don't know a lot about or is inaccurate. And so again, here's a spot where, you know, don't speak to something you don't know about. We're going to provide some resources where if you want to learn some more things to answer about vaccines, you certainly can. But when we get to the resources, I also want to mention there's one about evaluating sources. And it's something you could certainly prepare as a handout and send it with the patient. Say, I'm really glad to hear that you're doing your own research, even though you might think what they're doing is not appropriate or terrible sites, or they're getting this BCG information or all these other things, that they were magnetic. You can validate. It's great that you're doing your own research. I have a handout that talks about how to evaluate the sources you're looking at. Would it be all right if I sent this with you? So those are some things you might try. Okay, so Emily, if we could go to the video and watch, I'm hoping that we have time for the rest of it. Yeah, let's watch at least 5 minutes of it, and then we'll probably have to pause.
Right? Like, how do I know you're not like, and not when I say you, I'm not talking about you personally, but I know that you represent, you know,
I represent the field. Yeah.
field, right? So like, then how do I know that you're not like trying to figure out how this works in Black and brown bodies? Like, I don't know that, right? I don't know that. So I have a lot more questions than I do answers.
Yeah.
And so that's why I'm a little bit ambivalent about receiving the vaccine. Now, for my mom, on the other hand, I feel like because she is maybe in a high risk category, I want to do what I can do to make sure that she's around and healthy, right? But when it comes to me, I know it sounds a little weird, but I'm not there. I'm not there.
Gotcha. It sounds like with your mom, you're at this point where her level of risk is high enough that it kind of wins over whatever concerns you might have. Whereas with you, it's kind of like, you know, it's kind of below that threshold.
Yeah.
So yeah.
With all of the conditions that I have, right? 'Cause
Right.
You're upping my medication as it relates to my high blood pressure and my diabetes, and I get that.
Right.
I get that. That puts me in a risk category. Like,
Yeah.
I'm very well aware of that.
Yeah.
So Dr. Burns, that's where I am.
Yeah.
And not really sure what to do to move from this place.
Yeah.
Now,
Let me ask you, what would kind of bridge that gap between your threshold of getting the vaccine and your feelings that it might be beneficial to you?
I think time. And what I mean by that is seeing how it plays out with the people who have already received the vaccine. And again, I know it sounds harsh, right? Like, let me see how it works in you first before I get it. So I think time, maybe more information or up-to-date information of, you know, what's happening.
Yeah.
And it doesn't.
So it sounds like it's not just time, it's like time plus information, experience, you know, kind of getting, you know, more of that would be helpful for you in making the decision to get the vaccine. Let me ask you, why are you, as long as your mother's okay with it, why are you feeling that?
You just go back to the big screen and go to the slides. Can everyone hear me again? I unmuted myself, but I'm hoping that you can.
Oops. Yes, we can hear you.
Great, thank you.
Let me make sure this shares. Here we go.
So one more, okay. So I want to make a comment here and then have you break out just for a few minutes again so that you can share a little bit. I know you're not getting a lot of time in any of that, but it's just to have a couple examples that you hear from other people. You heard some things about change talk. This is a list of things we've talked about. I've already mentioned travel, elderly patient, elderly parent. She talked about her mom. And then she also talked about some of the other things in terms of people of color and those kinds of things. So we heard some more places of change talk. So yeah, Emily, if you could put people in breakout rooms for about 4 minutes, I'd like people to just share what you heard now that went well and what could have been better.
Sounds good. All right. You will see invites for your rooms. Let me know if you have any issues getting in. Sorry. They have a minute left. Oh, and I just got your text. Thanks, Susan.
Yeah, it's actually, yeah, it's, I just did so, and then I put 2 slides that I want to do, and then I'll wrap up because, like I said, I would have loved to have everybody for a few hours, but it doesn't work that way.
It's hard with a, it's
don't
a short one. Did we ever create a list of these resources so we can email it to them?
Yes.
Perfect.
It's probably going to have to get done afterwards rather than put in the chat. I've got to wrap things up fairly.
Oh, no, totally fine. Yeah.
Yeah, I hope to do, but you'll see them coming up too. Oh, so that's the resources. If you could go to what I see is slide 23 should have listening at the top.
Oh,
there you go. Okay, yeah, that's where I want to be. And then they're coming back, right?
Yep, they're back.
Okay, hi, everybody's back?
Yes.
Okay, great. All right. In the interest of time, what I want to do is just hear from each group one thing you heard that you liked. So group 1.
And that's Eva, Jesse, Sarah Long, and Trish.
We discussed that it was good that he went back through with her on the importance of her being high risk as well.
Being high risk. Okay. Group 2.
Group 2 is Joshua, Caitlin, Carrie, and Lenore.
Okay, we Found out we didn't have a group 3, we have a group 4.
I changed the name, so it's actually group 3 now.
Okay, all right, you call on them then.
So that's Mackenzie, Sarah, and Stacy.
This is Stacy. There were only Sarah and I in there, but we both really enjoyed that he paused to give her time to state her own risks and that she knew that she was high risk for certain things. And then Sarah said she really enjoyed where he brought up bridging the gap. Like how do you see bridging that gap to get you from here to there?
What would it take
what would it take? There it is. Yeah, what would it take? I like that.
Next group.
Last group is Amy, Alicia, Kim, and you. That doesn't count.
That don't count.
Well, sorry.
My main takeaway was also that what is it going to take to get you there, I think was a good question. Kind of let him know where she was at.
Oh, sorry. It's an open-ended question. It doesn't require yes or no, and then she gets to talk some more and hear those things. So thank you very much for sharing those things. And in the interest of time, I want to do some reminders about listening to patients, and also just a couple reminders about the whole process, and then we'll wrap up and we'll end on time. I know that this is scratching the surface. I'm very aware of that, but you only have so much time. So if this piques your interest at all, there's always more to learn. So I have the slide up on listening. And my favorite thing to teach in all communication classes is listen to learn, don't listen to answer. And we do that in our everyday lives too. If we are already formulating the answer in our head, we absolutely are unable to hear what they've said. Listen to learn, not to answer. Truly hear their concerns, regardless of the accuracy or the viewpoint they hold. Absorb what's being said without taking it personally. And I've tried to cover that. I'm hoping that's a takeaway for you. It is not about you, even though it feels like it. And I've already talked a little bit about tips for making this possible and or easier. And I'd like you to have the takeaway that it might ultimately, the investment in time may ultimately make your job easier, and you walk away with less stress about feeling like you're always being baited for something. That's the word I use, is whether I'm at work or I'm away, is stop trying to bait me for a debate. It's not about you. It's about hearing them. Okay, and Emily, if we could go to slide 26, I believe.
You'll have to tell me which that one is because the numbers are different.
Keep going. Like 2 more. The reminders, actually, right here. So the reminders, just about this whole process, is that whether you use one of the ORs, or you use one of the EPE, or you use part of the spirit, which is compassion. We have ideas of reflecting back what they say. That I mentioned before, it's practice, not perfection. I will tell you, just like any other skill, whether it's skiing or it's anything else, the more you do it, the more comfortable you'll get. Maybe you just try one strategy. One of the things I do when I'm trying out a new skill, I write it down on a note card and I keep it on my desk. Or when I was answering phones in the throes of COVID, I would have one thing that I knew that I could say almost every time to de-escalate someone. If they give you a flat out no, it's perfectly fine. Don't take it on. Thank them for their boundary, move on. Think about it as 2 to 3 minutes, not having to be a whole conversation like we saw on the video. Now you might get that and it might get somebody vaccinated. Whatever amount of time you put in could lead to change 3 months down the road, or it might change right that minute. And hopefully that learning a little bit about this process and these skills increases your comfort and ultimately the effectiveness, which is more vaccinations. Okay, if we could go to the slides about resources, I just mentioned that they're here. These resources are things to help you. That top one is one I mentioned about finding credible information, which is something that we're going to send you the pages. These are on in a Word document, and Emily's going to email these to you because obviously you can't click on them right now. But that top one you can make into a handout if you wanted to. It also helps you evaluate your resources. Next slide, please. These are resources that you might want to give for patients. Again, it could end up being on a handout or again, you're gonna have to be careful there. Ask permission. You may not need to use them, but they might be something you want to consider. And the next page, please. This is very detailed information for healthcare personnel. And I know some of you are administrators, but it might be information that you want to share with your staff. Here's something that you consider, and you're going to get all of these post presentation as well as an evaluation link. And then if you could go to our very last slide, I think it's our very last slide. Wrap up. I mentioned the evaluation link, and I want to give special thanks to the people I mentioned at the beginning who helped create some of the curriculum that we developed from there for this presentation. I want to thank Susan. Susan, you can put your face in here for a second because yeah, and she did a great job in helping me give some ideas about what would be helpful to you. I really want to thank Emily for helping me with the tech, particularly when it sometimes goes awry. We have the love and hate for Zoom, but I'm grateful that I had a chance to meet with you and talk with you all a little bit about the skills of motivational interviewing. One more slide, please. And just a big thank you, not just for attending today's session, but I know what you're doing is hard and you should be honored for that. And don't be too hard on yourself, just give it a try. So thank you all for attending today, and thank you for all the work that you do. Have a great rest of your day.
Thank you so much, Julie and Susan. I've put a Qualtrics survey link in the chat. That's just a quick evaluation if you don't mind filling out for us. It just helps us as we continue to make these trainings. And then yes, you'll get an email from me with some resources in it soon.
Thanks again so much, Emily, for all your help.
No problem. Thank you. This was awesome. Thanks, everybody.
Talk to you later.
Thank you.
Thank you.
As you creepily slide back into view, Susan, or I mean, Julie, I keep looking at, it's named Susan in Zoom. And I'm like, I know you're not Susan, but.
I am not. That's fine.
All right. I usually wait for a few folks to wander off.
Yeah, I wanted people to make sure that they were signing out too, and then just check in with you.
Exactly. All right, folks, click on that link if you haven't, and I'll close the meeting in just a second.
Okay, that sounds great.
All right, everybody. I'll talk to you soon, Julie. Take care.
Thank you.